2020 at 6 p.m. Purpose of this meeting is to provide kind of a public response session to questions that we have received over the last week or so relating predominantly to the COVID-19 situation in town. Let me just go through some preliminary information. This open meeting of the Northborough Selectmen is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings. And as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which is noted at the top of the agenda for this evening's meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The posted agenda does give you the information about Northborough cable access television government channels, Verizon channel 30, Charter channel 192. There's also a bit.ly URL, which is impossible to pronounce, where you can live stream what's going on. And you should be able to go to the town website, cable access television department page, and find a link there to connect to the meeting. This is a public access. It does not ensure public participation. Of course, the purpose of this meeting entirely tonight is to be responsive to some public input we've received. This meeting is being conducted by Zoom. I'll remind the participants who are here with us tonight that are visible and being recorded. Anything they say or do will be part of the recorded meeting. Ask you please not to share your screen, and ask you, in most circumstances, probably to mute your microphone when you're not speaking so that we don't have any intrusive sound. In terms of the ground rules, or not so much the ground rules for tonight, but the format of this evening's meeting, we'll have some brief opening statements concerning just updates, latest updates of information. We don't expect that these will be very time consuming. These will just be basically piggybacking on information we presented earlier. Information from the town administrator, from the fire chief, from the senior center director and the family and youth services director, from the school and superintendent. And then at that point, we will move into going through the questions we received, noting the submitters who presented them, and provide the responses to those questions. So I think that completes everything I need to do as a preliminary matter. On the posted agenda for tonight, we did have one item: approval of April 27, 2020 meeting minutes. We did not receive the draft of those minutes in advance of the meeting, so I think we will just pass over that item and proceed to the public information session. So at this point, what I would like to do is well, let me just say as a preliminary matter, we understand the concern that people have about wanting to provide public input. We've tried to provide an avenue to do it this way at this time, allowing you to submit your questions by email, and then being able to have responsive answers for you in this session here. We'll be looking to try to make some progress in the technology we have available as we conduct our public meetings, and to provide live public input at those times. We are not at that stage yet, but we are working toward that. And I want to thank the technology contributors here in town staff who are putting that into place and trying to get the right technology in place and get the staff training in place that we require in order to conduct those meetings securely. That's really the one of the main considerations we have here for this. So I would like to just quickly go through to just to ensure that we have everyone connected and present, and to introduce everyone who's going to be here tonight. First, starting with the Board of Selectmen, I'm Jason Perot, Chair of the board. When I call your name, please unmute yourself and just give a voice response so that we know you're connected. Vice Chair Don Rand. Don, you're muted. There you are. Clerk Tim Kalin.
Here.
Leslie Rattan.
Here, and also, Jason, if you can speak up louder, that would be great.
I'll see what I can do.
Thank you.
Yeah. And Julianne Hirsch.
Here.
For the Board of Health, we have the Chair of the Board of Health, Glenn French.
Present.
And we also have Dennis Costello, our interim health agent. Dennis? Dennis, can you acknowledge by voice, please?
Okay, hang on.
Yep.
Present.
Yes, thank you.
Okay.
For municipal staff, we have John Coder, Town Administrator.
Present.
David Parenti, Chief of Fire Department.
Present.
Bill Liver, Chief of Police.
Present.
Scott Charpentier, Director of Public Works.
Present.
June David Fors, Director of Family and Youth Services.
Present.
We have Liz Tretiak, Director of the Senior Center.
Present.
Jason Little, Town Finance Director.
Present.
And Andy Dowd, the Town Clerk.
Present.
Great. From the school system, we have Superintendent Greg Martineau.
Present.
And I also want to acknowledge we have cable access television, Kathy Dalgleish, who's connected to our meeting in order to conduct the live stream. So thank you, Kathy. We appreciate it. The public health nurse, Ian Labonte, who has been present at some of our earlier meetings, was unable to be here tonight, but she is available for us to follow up with for any questions that we may not be able to answer this evening. With that, I'd like to turn it over next to Town Administrator John Coder to provide a summary of where we are in our response to residents and how they can obtain more information. John?
Thank you, Mr. Chairman. So I just have a few brief remarks. I just want to remind folks, although you may have been tuning into previous meetings we've had multiple sessions where we provided information. We've had the chamber in, we've had our Family Youth Services Director and our Senior Center Director in, and of course, every meeting going back to March, we've had extensive discussions regarding COVID-19 and our response. I guess what I would like to do for this evening is just remind folks that the best place to get information pertaining to our COVID-19 situation, our response, and our resources is the town's website, and that URL will be listed on the screen. If you click into our town's main webpage, there's a COVID-19 dedicated page. It has all the information and the press releases from my office, from the Board of Health, has all community resource guide. So if you need any sort of assistance, all that information is listed out there. And there are links also to resources for businesses, for individuals that maybe need assistance obtaining unemployment benefits, as well as information regarding town meeting and the election. So you can submit a request to obtain a mail-in ballot all through the web page. So the primary resource for us, that we're putting everything through the web page, but we're also, I encourage people, if you go on there, you can sign up to receive email notifications under the town news, so that anytime we have new information to share, it'll be sent to you automatically by email. You don't need to come and visit the website. And then last but not least, in the event of an emergency, our primary notification system is known as Code Red. There is no reverse 911 anymore. So the town of Northborough uses a system called Code Red. And again, if you log on to our website, it's shown very prominently on the homepage. And if you click on that, you can sign up to receive emergency notifications. That means you won't get routine, but you'll get key important notifications. We've made a conscious decision as an emergency management team in Northborough not to pepper you, the public, with random minor things. So we use this in the event of an emergency or critical information that we need to get out to folks. And you can receive that information on your landline, on your phone, by voice, by text, or by email, or all of the above. So it's important, if people want to stay informed, those are our primary avenues of communication. We also have been putting all notices on a local access. the channels that the chairman just mentioned under Verizon and Charter. And as well as we've produced a number of shows for local access, explaining for folks where they can get resources and benefits and assistance if needed. So again, the best place to go is the town's website. If you're looking for official Town of Northborough and official State of Massachusetts resources, information that you can trust, please visit that website and take advantage of that. We update it daily, and the information is continued to remain fresh. And as more information comes up, we'll make sure that we get it up and post it for folks. So I just want to make sure everybody knows that's the best place to get the official information from the town of Northborough. Thank you.
Thank you very much, John. Next, I'd like to call on Fire Chief and Emergency Management Director David Parenti, who is going to give us an update for some of the statistics we've been seeing and some of the constraints in reporting that apply to us. So thank you, David Parenti, Fire Chief.
Thank you, Mr. Chair. Firstly, I want to let everyone in town know that all public safety personnel right now are healthy. We are fully staffed. We're somehow the police, fire, and public safety communications have kept everyone healthy. We're fully staffed, ready to respond. Where our personnel are all taking all the proper precautions and all the responses. So therefore, we've been, I want to say fortunate, but I also like to think that we've been very cautious. So all of our people are ready to go. As Emergency Management Director, we put together a team back at the end of January, beginning of February. Sometime we call it the Emergency Management Team. Sometimes we call it the COVID-19 Task Force. It depends what mood we're in. And that team is made up of Public Safety, myself and Chief Liver, DPW, Town Administrator Cordair. I was looking at Scott, I apologize. Jason Little, Greg Martineau, Liz and June, and Andy. And we meet, I like to say weekly, but we probably meet several times every week. And what we're doing is we're planning for the current events, but we're also looking for where we're going to be in a week and 3 weeks and 3 months and 4 months and planning for those events as well. So what are we going to need come the summer? What are we going to need when school starts again? And this team has been incredible. The amount of hours, the amount of work that they've done, I'm incredibly impressed with what they've been able to put out. We also vet all the stuff that goes out onto the webpage and all the information that goes out anywhere through town. So that's been very good. One of the big things I've been doing is working with Ann Labonte, our VNA nurse, with the numbers. Now, before I get into the numbers, it's important for everyone to understand what kind of constraints we have as far as what information we can put out. I know people would love me to tell you all what their addresses of the people who are positive are, or what neighborhoods they live in, or even what areas of town they live in. And those are all actually violations of HIPAA, okay? The Governor Baker passed a law that said public safety personnel, myself and my personnel and Chief Liver and his personnel can know the addresses of people. That is it. We cannot know their gender. We cannot know their age. We can know their addresses. That's how we track what our cases are. I know some bigger communities have that information. They have full-time people, full-time VNA nurses. Our nurse takes care of 6 different communities. So she's stretched very thin. But let me give you the information I do currently have. So right now we have 98 active cases. Of those 98 active cases, 63 of them are in skilled nursing or assisted living facilities within the community. So that's a fairly large chunk. That leaves 35 people on the general population. We also have 52 people who are listed on our recovered list for a total of 155 cases that we're tracking in Northborough. Those numbers are, I know some people are concerned and say, well, the numbers are really high, but again, I'm going to point you to 63 in our skilled nursing versus 35 in our general population. I think is a pretty good number for us to have. We're on top of it every day. Ann's keeping me apprised. I'm keeping Chief Liver apprised, and then we keep the town administrator in the loop every now and then. We let them know what's going on with the people. Any questions for emergency management or fire? I'd be happy to answer.
Great. Thank you very much, Chief. And now we'll move to Senior Center Director Liz Tretiak and Family and Youth Services Director June David Fors to provide an update on some of what has been going on in those areas. Liz, why don't you begin?
Hi, thank you. And thank you again for allowing me the opportunity to let you all know what we're doing here at the Senior Center and the initiatives that we've undertaken for our residents here in Northborough. We began by identifying in the community who our at-risk residents are, and we reached out to all of them individually and set up call plans for scheduled contact to ensure their well-being. Then we began calling all of our senior residents in town over the age of 65. And we began this several weeks ago, and the list was well over 3,000 names, and we've been working our way through that list. We'll continue checking on our seniors' well-being and ensuring that residents have everything that they need. And again, I'm pleased to report so far that we haven't encountered any major crisis situations during these phone calls. We are also keeping in contact with our adult caregivers who care for loved ones with dementia at home in the community, and just making sure that they feel supported and connected to. Throughout the situation, we have been continually taking stock of all of the resources and benefits that are available to Northborough residents. We keep that information up to date, and we share it on the website and through our Senior Center newsletter. We recently created a new Northborough Community Resource Guide. It's available on the town website, and it covers information for residents of all ages, not just seniors. So if you would like a hard copy of this, you can call me at the Senior Center. Otherwise, you can access it on the town website as a PDF with clickable links. I also just wanted to say that we're encouraging all senior residents out there who are feeling isolated or lonely. Please give us a call, even if you just feel like you need a social connection. We are here for you, and we will be happy to speak with you. Our physical programs are on hold at the moment, but all of our staff are still working, and we're ensuring that our seniors' needs are met. Through our outreach program, we have an abundance of resources here available to assist people that covers everything from grocery delivery to emergency funds to help pay bills, housing resources, shelters, insurance counseling, and that's just to name a few. We're actively keeping in touch with our community partners who also deliver services in the community. That's our food pantry, our local aging services access point, which is Baypath, Meals on Wheels, the other town departments, and our regional groups. And we're collaborating with everyone to make sure that all seniors are getting all of the assistance that they need during this time. And that's it for my update. Thank you.
Thank you very much, Liz. June? Could you unmute yourself, June, please? Yep, thank you.
Okay, I think I got it.
There it is, yes.
Okay, thanks. So I'm pleased to have this opportunity, especially to remind residents that we are still here. Department of Family and Youth Services, although we're not seeing people face to face, we're still here. We're available by phone, and we are providing all of our services from counseling, fuel assistance, applying for food stamps, referral information. And while I'm mentioning this, I want to let people know that the fuel assistance deadline has been expanded to May 29th. And the reason that's important is because people may have lost their jobs in the recent past, so they may now be eligible for that program. So if you have any question, please call us. I also want to support Liz's comment about reviewing the updated resources on the web pages. And I want to assure you that there's some great work being done in the community, especially due to our long-standing relationships with many of our partnerships, from Helping Hands, the Food Pantry, the Interfaith Clergy. We are all truly working closely together to try to meet residents' needs. And the last thing I want to mention is that if people would like to make donations to organizations such as the Northborough Food Pantry, Helping Hands, or the town's benevolent trust fund, that the information for this will be posted at the end of this program. Thank you.
Thank you very much, June.
Mhm.
And next, I'd like to hear from School Superintendent Greg Martineau.
Thank you for the opportunity. I think that this forum is symbolic of the collaborative efforts that have taken place, as Chief Parenti mentioned, since January. I felt very supported and very pleased with the collaboration with the town. I think Town Administrator Kader, Chief Parenti, Chief Liver, and all the members of the COVID task force have had the best interest of the community and the schools in mind. We've appreciated the alignment of communication, the vetting of communication, the sharing of resources and planning of resources. For example, the food delivery of lunches. The COVID task force was instrumental in providing guidance on that. And then just information sharing, hearing about information that we're hearing out in the community. So as an educational system, we're a large organization. We have a little over 800 employees across our 3 districts, and we have a little under 4,500 students that we educate pre-K through 12. March 13th was the last day our school facilities were open. However, learning has continued. Safety and well-being has been the greatest priority of faculty and staff, and our educators have done an outstanding job making sure there's continuity of learning during our facility closure. Our educators have developed NS Borough Connect 2.0, which is our version of a learning environment in the virtual setting. And it's almost impossible to replicate what happens on a day-to-day basis in our classrooms with our educators. But I'm very proud of the work that our educators, faculty, and staff have put forth in the best interest of students and families. This week is Teacher Appreciation Week, so I also want to let parents know that happy Teacher Appreciation Week. So parents have really stepped up and have been great partners in the work, and have really been asked to take on quite a burden in terms of being educators and trying to continue the learning that has taken place typically in our schools. Currently, we're in planning for reopening. We're looking at logistics. Our facilities will be closed for the remainder of this academic year. Remote learning will continue through June 16th, but we already are in the planning phases for the fall to think about how we can re-enter and open in a safe manner, and also really think about our students' well-being and what types of needs they will bring in terms of when they return. And lastly, I just would like to thank the district physician, Dr. Safdar Medina, who was planning on being here but could not be here this evening. He's been a great resource. We've always used the medical professionals as our guiding light, and also Mary Ellen Duggan, who's been the wellness coordinator. She's coordinated a lot of efforts around food services and nursing and making sure our families have what they need. So I'm very proud of the work and the response of the school department and the employees and the teachers and the students. And I'm also just want to thank Town Administrator Kader for the partnership and the support that he's provided me during this time.
Great. Thank you very much, Greg. The next phase is to go through the public comments that were submitted by email through the town website. We had, I think, something on the order of 16 submitters who offered some questions, several of them, or most of them probably, with more than one question. So what we're going to do here is we'll just proceed through them in the order that they were received. I will identify the submitter, name and address, read the question, and we'll just go to the appropriate member assembled here who can be responsive to that question. So let me begin. First questions submitted were from Jim and Jerry Dunlap at 15 Meadow Road. First question is, will the town consider all residents to wear masks when walking or going on errands? Local small businesses such as the post office, CVS, Rockies, etc., have signs asking customers who enter to wear masks, but not many follow through on the request. John, would you care to capture that one?
So this has probably been the most prevalent question that we've gotten over the last couple of weeks, and it's worth discussing a little bit. So on Monday, the 4th, we had a Board of Health meeting, and we actually had on the agenda for that meeting a local facial covering order that the Board of Health was going to take up. Now, the reason why I'm answering this question is because we actually had people months ago, a month or so ago, asking us, will the town require facial coverings? Could the town do this? Why haven't you done it? And so this has been one of those areas that's it's been interesting. Let me just say that. So we originally had a legal opinion from the Attorney General's office dated April 15th that said the town had the ability to issue an advisory on facial coverings. And if you remember, the governor had issued an advisory regarding facial coverings. And so that's where we were, and we were operating under the advisory mode issued by the governor. On April 27th, the Attorney General's office issued a revised legal opinion, or revised update, that stated the towns and municipalities could, in fact, require or mandate appropriate facial coverings. Now, so that was on Monday, the 27th. So then you saw several communities that week start to look at and discuss issuing a local order. And so we discussed it here. We scheduled a meeting for the Board of Selectmen, for the Board of Health for the following Monday. That was posted on Thursday of last week. And then on Friday, the 1st, the governor issued his order mandating facial coverings. And so facial coverings are now mandated, and they are required of anybody working in an essential business or going into an essential business, or locating in taxis, public transportation, or even outside, like say at a farmer's market, where you're unable to abide by appropriate social distancing. So, so this is now, in fact, a statewide order issued by the governor that applies to Northborough businesses, and Northborough residents as well. So that's that was one of the questions, so I think it's worth kind of giving that little bit of background as to what we did, when we did, and why we did it. And so, like most things related to COVID-19, this is an evolving issue, and even the legal opinion from the Attorney General evolved over the last couple of weeks, and then everybody acted appropriately. So, but at this point in time, we are operating under the governor's order. And one thing that the Board of Health did take up at their meeting on Monday is they designated the Northborough Police Department and the officers in it as agents of the Board of Health for purposes of enforcement of the governor's face covering order.
Thank you, John. The second question, will the town enforce the no gathering in large groups at public parks and playgrounds as ordered by Governor Baker? Many residents ignore that request at Ellsworth Park. How often do the Northborough Police check these areas? Chief Liver, would you care to respond to that?
Certainly, Mr. Chairman. The governor's order actually doesn't ban large gatherings at public parks. As a matter of fact, the governor's made it fairly clear that he thinks the ability for people to get out and recreate and use parks is important, provided they use social distancing, and or if they can't, they wear a mask. So it specifically exempts, as long as people are social distancing at a park, it does not apply. The face mask obviously does now, but as far as the large gatherings as long as they meet the criteria as set out in the guidance that the governor's office put out that we have, we would not break that up. We would go to individuals that were not social distancing. We'd approach them and ask them to voluntarily comply. We'd give them a warning and potentially cite them. As far as how often do we patrol the parks, quite frequently. I make a point of doing it at least twice a day myself. So I drive around my cruiser, maybe they didn't see me. I was down at Ellsworth McAfee today on 2 occasions, and there were 4 people on two basketball courts. They were just shooting hoops, one on each end of the court. Perfectly fine. So if we see people that are playing basketball or anything like that, we'll deal with that. But again, I think I can answer some of these questions that might be coming up by just summarizing our approach to this. And my direction to my officers is to put their focus on education and awareness. We are not interested in penalizing our residents, especially in this trying time. The fines can be hefty. So we will engage with them and ask them to wear their masks. If they don't have a mask, we've just recently partnered up with St. Rose as a volunteer group there that's making face masks, facial coverings. They're going to be providing us with a good number of those. So in lieu of ticket, we will offer them a mask, and hopefully they will take advantage of that. If they don't, well, they're forcing our hand. But it's again, it's all about education and awareness, in my opinion. So again, I think, like I said, governor's orders prior to our being appointed as agents, they were all health regulations that would have been enforced by the health agent. There's the statute does say that it can be done with the assistance of municipal police, but that we lack the authority on our own to act. So now that we're agents, we can act on behalf of the board. And again, the focus that we have chosen to take is education, awareness, warning, and then subsequent action.
Thank you very much, Chief. A third question is, will residents who have no signs of the virus have the opportunity to be tested if they so choose? Does the Board of Health expect that at some point the Mass Department of Public Health, with cooperation of the CDC, will contact cities and towns to offer resident testing? John, would you care to respond to that one?
Sure, and certainly Dennis Costello, our interim health agent, can follow up if there's additional comment. But basically, this is a recurring theme of the governor. Every press conference, he talks about testing and the need for testing. But at this point in time, we're not aware of any plans of any widespread testing at the local level, although we have had and made use of testing from the National Guard for some of our nursing homes and assisted living. Specifically, they were here a couple of weeks ago doing testing at those facilities. But right now, if you're an individual and you have been exposed, or you've been contacted, or you're symptomatic, the advice consistently is that you should contact your primary care physician and determine whether or not testing is appropriate or necessary for you. Dennis, I'm not sure if you have anything to add on that.
Yeah, just to going forward, we do expect at some point to have testing capacity in the state, or we hope to. And right now, the Mass Department of Public Health, in cooperation with the CDC, they are trying to get more testing kits out to all the cities and towns. So we should have, at some point in the future, the capacity for testing. And if not for testing for the virus, antibody testing or something. But that remains to be seen how widespread we can actually do it. And that will be in conjunction with the CDC and the Mass Department of Public Health.
Great. Thank you, Dennis. And then the final question was, how does the Board of Health break down those who have contracted COVID-19? And this basically goes back to Chief Parenti's statement earlier. By gender, by age, hospitalized, 14-day home quarantine. What are the cluster numbers in nursing homes or long-term care facilities in town? Chief, could I just ask you to just briefly restate those numbers?
Sure.
Thank you.
Certainly. As soon as I find my paperwork. See, I moved it all because I thought I was done. So there's 98 active cases. Of those 98 active cases, 63 are in skilled nursing or assisted living facilities. 35 are in the generalized population. 52 we have as recovered. So our total cases are 150. Now it's important, and I didn't point this out initially, but there's a real reporting issue with the assisted care and skilled nursing facilities. And this is what the issue is. If my father lives in Oxford and he is in the Beaumont or at Whitney Place or wherever in Northborough, and he gets sick and the address they use is Oxford, the report goes back to the Oxford town Board of Health, doesn't come to us. And it's vice versa if someone from our community is living somewhere else. And then we get a report for people that aren't in town, but their residents, their what they consider their permanent residence is in town. So our numbers, I do have some age breakdowns, but they're not accurate because none of the, I can't count on the data coming from the skilled nursing facilities and the assisted living to be accurate. So the numbers I gave you are the ones that I consider accurate.
Thank you very much, Chief. Next question was from Richard Swee of 230 Brewer Street, asking about the availability of town trash bags or more convenient access to town trash bags from the retail areas, so as not to have to enter a store and purchase them. Basically looking for contactless ability to obtain the town trash bags. John, do you want to just quickly comment on that?
Actually, Scott Charpentier will
Scott,
field
yes.
this one.
Thank you, Scott.
Thank you, Mr. Chair. So CVS does not sell Northborough pay-as-you-throw trash bags. We approached them when the program began and they chose not to participate. We have reached out to them again. They're waiting on, the local manager is waiting on a response from the corporate office on whether they want to be part of the program. That being said, we do have local retailers that provide both pay-as-you-throw trash bags as well as curbside pickup. Rocky's Ace Hardware does. I know Wegmans has the bags. I'm not sure if they have the curbside pickup for the bags, but Roach Brothers and Westboro does as well. So the bags are available. Rocky's does curbside pickup right in the center of town, relatively convenient. If there are residents out there that have the need for pay-as-you-throw trash bags and have no ability to get to a store for pickup, call us at Town Hall. We'll make arrangements to make sure your needs are met. Give me a call in the DPW office, 508-393-5030. We'll figure out a way to make sure you have the trash bags you need.
Thank you very much, Scott. Next, single question from Erica Zeiger of 2 Stratton Way. Will there be in-person voting on June 30th, or is it only mail-in ballot? Andy Dowd, Town Clerk.
Thank you, Mr. Chair. So that's a question that's come up a couple of times, and I'm going to explain the process to obtain a ballot by mail, but it's important for residents to also realize that we will be obligated to have the regular polling hours on June 30th, the date that's been scheduled for the town election. So people will have the option to vote in person that day. If they feel safe doing so, obviously we'll be prepared with appropriate protective equipment for our staff, and we'll be there and open for folks that wish to come and vote in person. And if I may just take a moment to explain the process for those that wish to avoid that and vote by mail. That process is very simple and open to everyone through the governor's order and the legislature's passing recently of the regulations related to the COVID crisis. So all voters are entitled to vote by mail. To do that, there's a simple application form that's on the town website, readily available in several different areas, including on the COVID page. They can fill out that application and return it. That form can be returned by email as long as it's signed, or mailed, or folks can use the Dropbox located at Town Hall. You don't have to use the form, and it's important to emphasize that. So folks that may not have access to the internet or be able to download the form, they can simply write a short note listing their name and address. Make sure and sign it because the regulations do require that it be signed by the voter, and then return that note through those same methods, either by email. I often tell folks just take a picture of the document, email it in. If that doesn't work, simply put it in the mail, or feel free to use that Dropbox at town hall. And then the ballot will be mailed to the voter. It comes with return envelopes and instructions, and then the ballot can either be mailed back to town hall, or they can also use the Dropbox to return the ballot. And it's important that they take action and make that request early. We have the ballots now. We actually just mailed out the first group of them today. And the sooner we get the requests, the better. That way we can allow for time for the mailing of the ballots and for them to get it back. We do need to receive it back by the close of poll on June 30th for us to be able to legally count that vote. Thank you.
Thank you very much, Andy.
Welcome.
The next question is from Gail Kelliker of 82 Church Street, asking why are police not breaking up groups of 5 or more playing basketball on school grounds? I believe that was a question of similar nature just answered by Chief Liver. I don't think we need to repeat it unless Chief, you'd like to comment.
Sure, Mr. Chairman. Just as an aside, we have encountered several groups of kids, young people and adults at the basketball courts. And what we're finding in a lot of cases is their relatives, they're related, their brothers, sisters, mothers, fathers, they live in the same residence. So it's pointless to tell them to socially distance. And that's not infrequent.
Thank you very much, Chief. The next questions are from Jorge Del Cid of 26 Washburn Street. The first question is, will the town run, as it's phrased, massive tests? If so, when and how? I understand that to be a question about whether there will be broad, wide-scale testing within town at some point. Dennis, would you care to comment on that?
Yeah. Do I need to be unmuted or?
Yes, you're fine now. We can hear you.
Okay. Yeah, the same answer kind of goes to a couple of questions previously, is that right now we don't know what the testing capacity will be or what the requirements will be in the coming months or beyond. So right now, this is what a big part of what the DPH, Mass DPH, and the CDC are currently working on. So the answer is we have no idea of when and how. We're just hoping that it will be sometime in the near future. I know that's not a great answer, but we just do not have that information at this time.
Okay, thank you, Dennis. The second question is, I understand the health policies, but why not give general information of cases in town, like area and or possible places where the positive cases have been detected? I think we've addressed that previously,
Right.
so we won't need to revisit that one. Third question was, is there any kind of task force preparing for a possible surge in the summer? John, would you care to tackle that?
Yeah, I would just restate what you heard from the fire chief, and that is we've had a task force in place for months. That task force will remain in place until it's no longer needed. And so we are continuing to meet. We will continue to review, as the governor likes to say, the facts on the ground and respond accordingly. So that group is in place, has been in place, and will remain in place until no longer needed.
Thank you, John. Next question is from Carol Keone at 15 Brigham Street. What extra costs can we assume for the future to better protect our town against COVID? John, I think I'll ask you to start that one off.
Sure. So first of all, for us, the impacts of what's happening right now on the town is more an issue of restricted revenues than it is expenses. We have incurred some minor expenses, but they tend to revolve around things like extra cleaning, particularly at police and fire. We did purchase an aerosol sanitizing device that can be used to clean cruisers, ambulances, buildings, and office space. That was was about $15,000 plus supplies. We're going to see some incurring of expenses with regard to personal protective equipment. We've incurred some expenses already, but masks, face coverings, gloves. At some point, as we talk about reopening, we'll need to modify some of our public building spaces with plastic plexiglass shields, things of that nature. The good news is, in place right now, under the Stafford Act, we have the ability to get reimbursed for up to 75% of allowed costs. And so not all costs that will incur will be reimbursed. But, at this point in time, you'll hear from the two chiefs. They'll both tell you that their call volumes are down. So we're not experiencing a lot of overtime at this point related to COVID-19 response. So again, we're going to need to remain flexible because as things evolve, we may encounter other expenses. But I think the biggest expenses we're going to see are things related to, like I said, cleaning, making our facilities safer, having PPE, protective gear, and just trying to work in a way that allows the public to safely come in and work with us, and for our employees to be able to help those folks in a safe manner. So we'll continue to watch that. But right now, as we sit here, we're not seeing a lot of significant expenses. But what we are doing is we're tracking every eligible expense to maximize any reimbursements that the town may be eligible to receive. So that will be an ongoing process. I think it goes back to the beginning of the year, but it ends at the end of calendar 2020 as of right now. And so we'll track all expenses, and we'll get every dollar back we can for the taxpayers of North.
Thank you very much, John. The next questions come from Michael D. Powell of 360 Whitney Street. The first one is perhaps a bit of a duplicate from what we discussed previously. Will the Northborough Police be interacting with residents who are outside exercising and clearly practicing social distancing regarding the mandatory mask order? Can you assure us that these residents will not be approached by police? What can residents do to avoid being approached by police? And the qualification here is, for example, a family walking together on the streets or touring a trailway or field or something to that effect. Chief Liver, would you care to just quickly repeat?
Sure.
Thank you.
I hope that's because they fear we might be a contamination source. No, the simple answer to that is no. If people are complying, the answer is no. It's clearly, when you see little kids walking down the street with their parents or on a trail, again, go outside, have fun, exercise, get some fresh air, follow the rules, and we'll wave to you. Listen, if we weren't in the middle of a pandemic, I expect my offices on a daily basis to interact with the public, to set, to have positive interactions and build some, positive community relationships. So we're not doing that because my officers, just like anybody else, they're concerned for their health and their family's health. They don't want to bring anything home. So we are practicing social distancing. We've had some extreme safety precautions in place for over 2 months now with PPE and station restrictions and vehicle cleaning. So we're very cognizant of that, and we're trying not to approach as many people as we can. So we hope everybody voluntarily complies, so we don't have to get close enough to hand citation. So,
thank you very much, Chief. The second question, again, is similar or repetitive to ones we talked about earlier. Can you please start breaking down how many of the Northborough cases are long-term care and residence facilities? It's difficult to derive the information from state level information. Knowing how many of these cases are in institutions as opposed to on the streets impacts how safe I feel patronizing the open Northborough businesses. The Northborough infection rate isn't significantly higher than the statewide average. Currently, Shrewsbury and Hudson seem like safer places to shop. Chief Parenti, I think you've quoted these numbers a couple of times now, but as you mentioned, I think something on the order of 150 total cases, 63 of which are in these assisted living or care facilities, and another 35, I think it was, that are general public non-facility cases.
Correct. There's 98 active cases. Of the 98, 63 are in skilled nursing or assisted living.
Okay.
35 are in general pop, and 52 are recovered.
Thank you very much, Chief. And the third question, what are the plans for town meeting? The current May date does not seem realistic. My preference would be to do it virtually. My second choice would be a midsummer evening outdoors in a large field, such as Ellsworth McAfee Park, with a PA system for the moderator and extreme social distancing on the lawn, at least 12 feet between chairs. John, would you care, or John or Andy,
Yes.
would you care to?
No,
talk to
I'd
that
be
one?
happy to reply to that.
Yep.
So as you know, in the Board of Selectmen or I'd rather with the town moderator in consultation with the Board of Selectmen at your recent meeting, made the decision under the legislation that allows the moderator to postpone town meeting by up to 30 days at a time. That's why the May 27th date was chosen. We will not have town meeting on May 27th. We may or may not have town meeting in June. So that's something that we're going to need to take up. The bottom line is, as long as the governor has the prohibition of groups 10 or more getting together, I see town meeting as being problematic regardless of the venue. More importantly, I think we're all waiting. The state is waiting for information from the federal government pertaining to stimulus funds and how those can be used. The towns are all waiting for information from the state regarding local aid numbers and what we're going to see for potential stimulus money coming down from Congress for revenue replacement, which currently is not allowed under the 2.7 billion the state is receiving under the CARES Act. So given all these things, there are provisions under the recent acts of the legislature that allow municipalities to move into the fiscal year on a 1/12 budget basis, working with the Department of Local Resources, Department of Revenue, and so or the Division of Local Services of the Department of Revenue. So I was on a conference call yesterday with the Mass Municipal Association, and right now they're only aware of one community that's had a town meeting, and they did it early on when and it was they had to do it to I believe it was a land purchase or something they had to do, but there's very few, that's it, communities that have had town meeting, and most are in a holding pattern. And according to, again, the MMA, that's surveying and contacting all the municipalities across the state, the vast majority they're anticipating are going to go with a 1/12 budget while they wait to get additional information from the state. So right now, if you want to know what's happening with the state budget, there's no information, zero information. If you want to know what's happening with local aid, there's no information. Although that doesn't mean that they aren't working feverishly behind the scenes to do forecasting and run various scenarios, very similar to what the town of Northborough and our financial team is doing and has been doing for quite some time now. It doesn't change the fact that, it's not ready for necessarily prime time. So we're waiting. They're waiting to get information from the feds. We're waiting to get information from the state. In the meantime, we're reviewing every local revenue, and we have been meeting with departments for potential cuts and modifications that need to be made to budgets as currently presented. So the May date does not seem realistic. You are accurate in that assessment. I believe when we postponed it to the 27th, we stated at that point in time that May 27th was not going to be the date, but under the legislation, we can only move it up 30-day increments. So we're anticipating that we'll be moving it again. And within the next month, we're going to have some discussions about what do we see for a potential town meeting date.
Thank you, John. And just one more clarification there, John, on the 1/12 budget amount. That's if we have not held town meeting before the end of this fiscal year, which is June 30, and the next fiscal year 2021, begins on July 1. If we haven't done town meeting by that time, there's provision for us to proceed on no greater than 1/12 of the previous year's appropriations, essentially, on a per month-to-month basis. Is that right?
That's correct. And it's not that there are provisions, because not all expenses that we incur is on a monthly basis is 1/12. For instance, we usually pay our retirement assessment in the first month for for a reduced assessment if you pay early. The division, Department of Revenue, Division of Local Services would be looking for a realistic proposal that makes sense for what 1/12 would be for that month, comparable to last year with a few other things. Obviously, they also understand that it won't be a perfect 1/12 because there are some cost escalations for things like health insurance. So there's a little bit of flexibility within that, but essentially, yes, you're looking at a 1/12 budget with some minor adjustments and some timing issues, but it has to be approved by the Department of Revenue, Division of Local Services, in order for that to take place.
Great. Thank you, John. Yes. Next questions are from Lisa Maselli of 13 Maple Street. The first question, since state revenue for our 2020 budget was such a small amount of the pie, 8.8% to be exact, why is the town putting so much emphasis on state aid before reworking the budget? John, as you just explained, would you care to just recap that one more time?
Yeah,
specifically with, state aid?
I think you got a couple of mixed messages here. One is that, state aid, it's all relative. So a neighboring community of Northborough gets, over 20% of their budget in state aid monies. On a relative basis, we get a smaller amount. And as you all know, since 2003, it's been declining from a high of 13.1% of our revenues down to under 9%, 8.8, and it will go lower this year. But the fact remains, state aid is the second largest source of revenue. And so right now, as we look at our state aid numbers, we go back and we look historically what happened during previous recessionary periods. What did we see for lost revenues? And the high point on a percentage basis for lost revenue was back in 03, 04, and it was a 17% reduction in state aid. So right now, our scenarios that we're running in our budget models that we're planning on, we're assuming a 17% reduction in state aid, which is approximately $1 million. So it's not a small amount of money. It's very significant, and it's critical for us to know what are we looking at. So the Mass Taxpayers Association recently did a revised revenue analysis for the state. They're forecasting up to a 14% reduction in state revenue. I've heard some legislative members indicate that it could be, anywhere from 14, 15 to 20%. One of the reasons for the delay is that, much like what the Board of Selectmen here in Northborough did, is the delay of a month of giving people time to pay their last quarter tax bill will delay also the data point where we have a good sense of where we are. So as we delay the tax bills being due to give people a little more flexibility, and that was the appropriate thing to do, it also skews or obscures the numbers for us for a little bit longer. And so the state is trying to see what their last quarter revenues will look like, so they can start using those to forecast forward. We're in a similar situation there as well. So, but just so everybody's clear, right now, the budget planning that's taking place, the models I've discussed with the superintendent for the school budgets, we're anticipating and modeling and planning for at least $1 million reduction in state aid numbers. So not insignificant.
Thank you, John. Question number 2, why can't the budget be rewritten assuming much less? In other words, plan for the worst, but hope for the best.
Yeah, well, as I've communicated to the board and the financial boards and committees, that's exactly what we're doing. We are forecasting what we believe to be a realistic worst case scenario for state aid and a realistic worst case scenario for local receipts. So our two big exposures on the revenue front are state aid and then our elastic revenues that tend to move with the economy. And those are our local receipts, things like motor vehicle excise. So people stop buying cars, we see those revenues drop. Building permits, with the freeze in the economy, we will see a drop off in that. And then hotel and meals tax, as you well know, with the shutdown. There's limited takeout taking place and limited hotel tax that's being picked up. So we're assuming right now at least a 14 or 15% reduction in our local receipts moving forward into fiscal 21. So that's really what we're doing. I'd say the biggest factor right now, unknown for us, frankly, is federal stimulus funds. As I said, the CARES Act released $2.7 billion that were coming and flowing through the state. It cannot be used for lost revenue replacement, and it cannot be used by the state to pay for their Medicare expenses. That's problematic. And if you're reading the papers, you're seeing a number of states who have access to these funds and they need them desperately, can't necessarily take advantage of the full amount that's allocated to them, because the issue that they're facing is lost revenue, and then their biggest budget buster is Medicare, Medicaid expenses, health insurance costs at the state level. And so the second stimulus package that's being discussed right now in Congress is specifically targeted towards state and municipalities. So, and could be used potentially, or what we're asking for is, revenue replacement. That can be significant funding. So my understanding is that's being discussed in Congress right now. And that's one of the primary reasons why you're seeing the state in a holding pattern and a number of municipalities waiting to see what happens with those stimulus funds. Now, we always try to look back, because history is helpful in predicting the future, right? So in the worst recession up to this point, back in 2008, 2009, what we saw was the state had lost a significant amount of revenue. The federal government came in with the stimulus funds. They provided those stimulus funds to the state. And in that particular case, the state actually, they cut our state aid significantly and then backfilled it with federal stimulus funds. And so that's how they essentially made us whole or minimized the cuts that we saw. And those were significant funds that made a real difference for us in that recession. That's what everybody's waiting to see. And that's what everybody's counting on at this point in time. So that's a big piece of information that we hope will be forthcoming. That'll help the state get some clarity and get some stability around their revenues. And that will certainly help the town of Northborough. Now, regardless of that, and I can't be any more clear on this, we have been working for the past month plus, meeting with departments, looking at where budgets can be modified and reduced. And we are absolutely, regardless of anything else, assuming for planning purpose, a loss of $1 million in state aid. And again, like I said, 14, 15%, over $600,000 lost in local receipts. So that's the minimum that we're predicating on. One unique position that the town of Northborough is in that some of our neighbors aren't, and they would love to be in our position, is that because of our very conservative budgeting over the years, we have not taxed to the maximum of Prop 2.5. That means we have over $2 million of levy capacity. So other communities prior to COVID-19 hitting were actually looking at overrides, some of our neighboring communities, just to meet their needs. Now they're dealing with that plus reductions in state aid. On the other hand, we actually have taxing capacity. We want to be very sensitive to this, though, because clearly we do not want to have a tax increase any greater than we need to, because we understand that businesses are experiencing a difficult time. Clearly, residents, not all, but many, are experiencing a very difficult time. So that's our focus, is on what is that level of taxation. And so I think what you're going to see coming forward from the school department, I had a meeting this afternoon with the superintendent. He has a meeting, I believe, next week with the school committee talking about their fiscal 21 budget amendments. I anticipate at your meeting on May 18th to be providing you some additional information update with regard to the fiscal 21 budget. But just to be clear, it's not going to be a one and done. This is going to be a situation that unfolds for the balance of this calendar year, well into the fall. And if you look at what the MMA, the discussions at the Mass Municipal Association, and you listen to what's happening in other communities. And I've said this at your prior meetings. In all likelihood, we don't have all the information we need, and we're not going to have all the information that we need leading up to setting the tax rate in November. So more than likely, unless we get fantastic news from the federal government with regard to that stimulus funding I just talked about, we may be looking at making budget adjustments in the fall. And I think that's what you're going to see happening around the state with most municipalities, certainly towns that have a town meeting form of government and don't have a council manager or a mayoral form of government where they can make these decisions on a weekly basis. So, but just to back up again, keep in mind, until the governor lifts this ban, no more than 10 people gathering, that's going to be problematic for anybody holding a town meeting. And that I don't see that changing in the next couple of weeks. So that's where we are.
Thank you very much, John. And the third question, what is the process for revising the town meeting warrant given the economic downturn due to COVID-19? I think I'm going to give John a break for a couple of minutes and try to tackle this one a little bit myself, and then John can have a glass of water and point out my corrections to what I state. The town meeting warrant was constructed this past year. If you've been to a town meeting, if you looked at the warrant booklet, then you understand how it's laid out. You understand how many of the warrant articles are the same articles from year to year, at least with respect to municipal finance. You have the municipal warrant article, the K-8 school budget warrant article, the regional, Algonquin Regional School, Assabet School, some treatment of revolving funds, some potential treatment of debt items, and capital expenditures for capital equipment, some reserve fund contributions. Those don't change year to year, and as the budget's constructed, it typically is constructed each year based on an assessment of rising costs and preserving level services. The Board of Selectmen essentially sets the policy direction for where they want the budget to be. For example, coming in under the constraints of Proposition 2.5, and the town administrator with his staff puts together the details of that budget, and likewise the school superintendent on the school side of things is putting together those budgets. When we come to town meeting, when the warrant is closed, those warrant articles have essentially set the upper bound on what those amounts can be. And so having proceeded with our budget construction this year, having written the warrant and approved and closed the warrant, we're now at a point where we've essentially set the upper bound on what the expenditures would be for fiscal year 21. From this point forward, there's not really anything that needs to be done to revise the warrant. What we would do from this point forward is re-examine where we are financially as much as possible or as necessary as possible, awaiting further guidance about federal assistance or state assistance, feed that into our forecasting, and then through the process of town staff reassessing various scenarios and trade-offs to make, presenting that information to the Board of Selectmen and to the Appropriations and Financial Committees, and likewise on the school side, school superintendent and the school committee doing the same kind of analysis, making the same presentation. We'd kind of arrive through agreement and through the board review process on some modifications or amendments to the existing warrant articles that would be offered at town meeting. So we will have probably amendments to the existing warrant articles, and you'll have the same kinds of recommendations from the various boards and committees, whether to pass over an article, whether to not approve or not recommend an article. And through that process, that would be the mechanism we would use to make any adjustments we need going forward. There really isn't a need to reopen the warrant or reconstruct the warrant or revise the warrant articles as they're currently written. As I said, they already represent an upper bound, and the question is, where below that upper bound are we going to fall when we finally get to the town meeting and make these considerations? So that's my take on it, John. If you've had your glass of water, feel free to supplement or comment.
I think you've covered it perfectly. So
Okay.
we'll be doing this process, and The trick is trying to figure out when we would proceed with a town meeting with appropriate information. So.
Right. Thank you. The next question comes from Leslie Shore of 34 Coolidge Circle. And she asks, who is in charge of organizing the town's response to COVID? Is it the fire chief? Fire Chief Parenti, would you care to tell us whether you are in control?
As I said at the beginning, it's a team approach. There are so many things to do that there's not one person in charge. And I have to give kudos to everybody that's on the team. It's no one says it's my way or the highway. It's all a matter of what do you think? And it's been a very much a team approach, from the schools to the administration to all the public safety, DPW, senior center. Everyone's worked together to get there. So there's not necessarily a single person in charge. Obviously, John, as the town administrator, carries a great amount of weight, and I happen to be the emergency management director, so I have all the contact with FEMA and MEMA and all that. But together, we all make the decisions.
Right. Thank you very much, Chief. John,
Yeah,
supplement?
I can't stress this enough. And early on, somebody had commented that geez, all of the releases that are coming out are coming from the Board of Health. And yes, and they were being drafted collectively by this group. And even when the superintendent was issuing some information, we were reviewing this as a group, any release that came from me, because again, it's really important for us that we're putting out consistent and accurate information. And that means people working together. And again, you heard from the superintendent in the beginning, you've heard from the fire chief. I'm going to say this right now. This team has been phenomenal. The cooperation from the superintendent and his office and his staff, from the public health and from the public safety and all the other departments, there's been, as the fire chief likes to say, there's no sandbox issues. Everybody here works very well together. And actually, Liz came into this team as our newest team member. And one of the first things she said to me was, you know what? She's been through multiple meetings with us. It's really nice that everybody seems to get along and work well together. And frankly, we're all flat out and there's a lot to be done. And it's nice that there's no interpersonal issues and there's no territorial turf issues. The cooperation, and again, the superintendent, I couldn't ask for a better partner during a crisis, a budgetary crisis, than Greg Martineau. I think we approach things rationally and realistically. And so what will come forward for the town ultimately, like all the actions we take in with regard to COVID-19 and including the budget and town meeting, you're going to see a very well thought out, sensitive and rational, reasonable approach. So thank you.
Thank you, John. The next questions come from Liz Nolan of 43 Ridge Road. Thank you for the opportunity to participate in the meeting on Thursday. Question 1, what is the status of our small businesses? Although there is a great listing on the town website of those currently open in some way for operation, is there a plan in place to support them additionally now and after restrictions are lifted and beyond? Is there a plan to have a more connected and involved economic development committee? John.
Yeah, so I think we spent a great deal of time on this at the last Selectmen's meeting. We had Karen Chapman come in, the executive director from the Quarter 9 Chamber, and really our partner to the business community and our liaison to the business community is the Chamber of Commerce. That's the design of this relationship and partnership. And so we're in constant communication. And as we saw, Karen and her team are running exhaustive programs and assistance for the small businesses in the chamber. And then most recently, we did try to do a local promotion. So essentially, if your local business is essential and it's open, we are promoting. We're not promoting the specific business, but we're promoting the concept to if you're going to do takeout or you need to purchase something, if you can do it at a local business and support them to help them out. They're hurting right now, as many folks are, but the local businesses, they need our support. And so we've been advocating that for them and asking people to patronize the Northborough businesses. But really our connection has been and will continue to be the Corridor 9 Chamber of Commerce. in terms of an economic development committee, one of the things that we discussed as part of the master planning steering committee's work was, is there going to be some sort of potentially a downtown business association or something like that? So that remains to be seen, and that would be an outgrowth of the master plan, I believe, implementation committee. But as far as we stand right now, if you're a small business in Northborough and you're not a member of the Quarter 9 Chamber and not taking advantages of the networking and the resources that are available to you, I strongly encourage you to do so. It's a fantastic chamber, great information, great programs, and great networking. So we will continue to work with them. But again, if somebody has ideas in terms of things that we can legally do as a municipality, we're open to hearing those.
Thank you very much, John. Second question is, with continued restrictions for public meetings, how will public comment be handled for upcoming meetings? I guess this one is in my court as the chairman of the Board of Selectmen. I kind of set the agenda and make the determination whether or not to invite public comment. I think we're putting in place some of the technology components that we require in order to not only conduct our meetings, but also to begin to roll out support to be able to conduct the meetings of other boards and committees in town. With that in mind, in order to conduct these remote meetings, we have some technology that we need to have in place to ensure that we have correct level of security so that the meetings aren't impinged upon by undesirable content. And we need to have the right training in place for board and committee members who are participants, or even potentially board and committee members who might actually be the hosts for a particular meeting, depending on the availability of staff to provide that support. So that is rolling out over the next few weeks, and we expect to have that in place very shortly. Our next Selectmen meeting is on May 18th. And at this point, I'm uncertain whether we will have live public comment at that time. If we don't have live public comment, I will be inviting another round of written public comment. We'll try to slot that into that meeting. I would frankly ask that any comments or questions perhaps be on other than the COVID-19 topic, which I think we've been continuing to try to address as we're trying to address here in this particular session tonight. But certainly by the first meeting, our first meeting in June, I would anticipate that we will have live public comment for the Selectmen's meeting at that time. John, would you care to add something, please?
Yeah, so just a couple of points to make. Phone still works, email still works. Staff is still here, your elected officials are still available. So if you have a comment to make to them or to staff, or you have a question, you don't have to wait for a Selectmen's meeting. You can email the Board of Selectmen, you can contact or call me or my staff, or email us, and we'll respond appropriately. But I did just want to follow up on what you said, what Chairman Pro said, and that is we do have a group that's working. We have purchased extensive licenses. We also purchased the webinar module for Zoom that allows for greater security and control. If you're reading the papers and you're seeing what's happening across the state, there's a lot of security issues related to particularly opening up meetings for public comment. And last thing we want to see is some inappropriate material or content coming forward. So we are working on that. It's important in this environment as we get additional boards and committees. And by the way, we have over 30 boards and committees. It'd be one thing if all we had to do was support the Board of Selectmen, but we have to support dozens of boards and committees, and that means making sure that the staff that's hosting and working with that committee knows how to use the software appropriately, that the boards and committees know the checklists that they have to follow, the disclosures that Chairman Perot made at the beginning of this and all remotely participated meetings, and then preserving the record for compliance with the open meeting law and the public records. So these are all things we want to make sure that we're doing correctly. And so that infrastructure, the software, the policies, and the training is what we're working on and have been working for the last several weeks on. And so as the chairman said, this is something that will be coming out shortly. We just want to make sure that it's done correctly.
Thank you, John. And third question from Liz Nolan. I was surprised to see the separation of employment of Casey Mellon. Will the interim health director approach the pandemic differently in any way? Dennis, would you care to address
Yeah,
that?
that would be me.
Yes.
Sure. The short answer would be no. As a health agent, I'm going to continue to work with the emergency management team and with the town administrator. And as we always do, the State Department of Public Health, the CDC, and we have other local public health collaboratives that have been done over the years that we still work with. And having had some contact with this town in the past, I still have some collaborations with other health departments, which is always helpful. And the team that you have is excellent, and I'm not going to disrupt the sandbox. So it'll be good.
Thank you very much, Dennis. The next questions come from Christine Cobb of 17 Greenwood Road. The first two questions look to be things that we have covered previously. Will the use of masks be enforced by the police, and will fines be given for not wearing them at the required times, places? I think Chief Leiber has already addressed that fairly thoroughly. Second question, please clarify usage of town-owned properties, school grounds, parks, etc. Are all school grounds closed, including tracks and tennis courts? I'm going to turn that one over to Greg Martineau.
So as Chief Leiber stated earlier, our school grounds are open and accessible to the public. We have closed our actual playgrounds because those are not cleaned on a daily basis. But again, people can recreate, walk the track as long as they're social distancing and wearing the proper face mask. So, we encourage people to use the grounds appropriately and enjoy the grounds in social distance, and no organized sports, obviously, no organized recreation. But again, our school grounds are open. Our actual playgrounds are closed.
Through the chair, if
Yes.
I'd like you to call on our DPW director to speak to
Yes.
town resources.
Yes, Scott Charpentier.
Thank you, Mr. Chairman. So echoing on what our school administrator said, superintendent said, same approach with the town fields, trails, facilities, amenities, and playgrounds. We encourage passive use. The fields are available for passive use and recreation. There can be no organized sports out there, no group sports. Organized sports is often seen as just youth lacrosse or youth soccer on the field, but a pickup game of 10 grown men playing basketball is an organized sport, and that's not complying with the state regulations. We also have our playgrounds closed. We don't have the resources for daily disinfectant, and I don't think any parent, especially myself, can get my toddlers to social distance on playground equipment. So we encourage the residents to come out. We have beautiful trails, parks, fields. We're maintaining them as we always have been. Come out, get some sun, get some fresh air. Wave to your neighbor from 10 feet away safely, but just don the proper safety equipment.
Great. Thank you very much, Scott. The next question from Ms. Cobb is, how are rules communicated to the town's citizens? Not everyone is online or on social media. John, would you care to touch that one?
Sure. So just staying on the theme of the parks, these facilities are physically posted. So if you go to the playground, you'll see a sign that says it's closed. If you go to a field, it'll tell you the field is closed to organized sports. So as I said at my opening comments, we have put out consistently the information through the town's website, social media, but also local access. The local access bulletin board. Liz Trediak has sent mailings out to seniors. So we've really tried to. We've also worked significantly through local media outlets and newspapers. So we've gotten this out every which way that we can, and we will continue to do so. It doesn't seem, in my assessment, that it's a lack of communication in terms of knowing the status of things. But certainly, if anybody has a concern or a question or they're unclear, give us a call. We'd be happy to tell you where things stand and what would be acceptable or what would be necessary for you to use a town facility or a recreational asset.
Thank you, John. And then finally, from Ms. Cobb, when will decisions be made about town events, Memorial Day and Applefest? I can comment on Memorial Day. As we discussed at our last meeting, we had a communication from Justin Sousa, our veterans agent, who in consultation with the state veteran services have determined that it would not be feasible or advisable to gather in groups for Memorial Day as we are accustomed to doing. And so there's some coordination going on between Justin and I believe American Legion Post 234 and BC Cares for Troops to put together a media presentation that's essentially a video recording of the procession to each of the memorials, the placement of the wreath, the proper observance being made at each of those locations, and some commentary by various people, as you might be accustomed to hearing over the years as we do the normal parade procession. So that would be the information for this Memorial Day. There will not be a public gathering. And as to Applefest, I guess I don't know what we can say about that. John, would you
Yeah.
comment?
So, in these situations, everybody wants answers, and unfortunately, we don't always have the ability to answer the question. And this is one of those situations. So, Applefest at this point in time, we're still operating under the governor's order, restricting the number of folks to 10 or less for gatherings. So clearly, Applefest does not comply right now. Probably more immediate is we have summer concerts at Ellsworth McAfee Park. Again, under the current order by the governor, those cannot proceed. What we don't know is what's going to happen over the next couple of months. Now, you've heard me say before, the governor has a reopening advisory board that he has created with 17 members, including 3 municipal officials on that board. And their job is to report back on May 18th with a plan and some sort of criteria by which there would be a phased reopening of the economy. Now, what does that exactly look like? We don't know. I will say, though, as a municipal official and through the Mass Municipal Association, I've offered comments that we would like there to be consistency, not just for reopening of the business sectors, but reopening of municipal services as well. So I would appreciate consistency from this advisory board and the state in terms of reopening senior centers, libraries, town halls. I mean, we're intelligent people, and we are working on reasonable accommodations in terms of protective gear and screenings and making sure people are wearing masks and things of that nature. But we're hoping that there's going to be some consistent information about municipal facilities and services, just like we're hoping there will be consistent information regarding the private sector businesses. So things like summer camps, we're getting calls, people want to know what's going to happen with summer camps. Well, the governor has been very clear, no summer camps until the end of June. So on May 18th, are we going to see potentially some guidelines from the state regarding things like summer camps and other municipal facilities? We're waiting to see. One thing I can tell you, the Lieutenant Governor and Governor Baker have been very clear. May 18th is not a magical day. All the restrictions aren't going to be lifted. The world is not going to be a radically different place than it is as we sit here today under the shutdown. What it is they're watching all the metrics, the number of infected folks, the number of hospitalizations, all the things that everybody across the country is watching, and looking for that downward trend for a period of time that says, okay, we may be on a declining in a declining infection situation, and we can start to carefully and in a phased manner with appropriate safeguards start to get to whatever the new normal will be. And nobody knows exactly what that will be. Obviously, if you're reading the papers and you're watching the news, the biggest concern from the public health officials in the medical field is that if we start to reopen, that we're going to see a surge again, a second spike in the number of infected folks and the number of people getting ill. And so that is a possibility. The governor has been very cautious about that. So we're just going to have to be and continue to remain in a waiting pattern on some of these issues, and also to be realistic. As I said, between now and 2 weeks from now or a week from now, there's still no effective treatment. There's still no vaccine. That's why I think what you saw when the governor made that decision last week to mandate facial coverings, that's really the only effective thing other than social distancing that we can implement right now. And so there is no phased reopening of municipal buildings or businesses and private sector activity without mandated and required facial coverings. That was a very clear signal that from the governor that as we start to go down this path, people need to take personal responsibility to protect not just themselves, but others with facial coverings and maintaining the social distancing. So as a long answer to a short question, which is we don't know, but we will constantly be revisiting this, and we will be looking at what the guidance is coming from DPH and the governor's office over the coming week.
Thank you very much, John. Next question comes from Mitch Cohen of 12 Whitney Street. And this is, as he phrases it, related to the COVID situation in that seniors who might be struggling financially due to the current situation may want to take advantage of this program. How many residents currently take advantage of Chapter 59, Section 5K, which is the ability of seniors over the age of 60 to volunteer their time in exchange for reduced taxes? Is our maximum reduction the standard $1,500 per year or some other amount? And does the town currently have excess opportunities for this that are not being filled, or do requests for this kind of service exceed the available opportunities? And this is all referring to the state of the program before this COVID-19 emergency situation, as volunteers or positions are likely to be on hold. So John, could you address that?
Yeah, just very briefly, for those that aren't aware, the Senior Work-Off Program is a tax abatement program where seniors can come in and work small jobs and assist in departments in exchange for up to $1,000 reduction or abatement off of their taxes. And it's been a very popular program. I will just point out that this program was started from the town of Chelmsford, going back when I worked there many, many years ago. Chelmsford brought this program to the Commonwealth, so I'm very familiar with it. We have operated it here successfully. We tend to get on any given year, 10 to 12 folks, and because of the number of people we have, in some towns you'll see they'll have a pot of money, and then depending on the number of folks, the more people they have, the less benefit they receive. Ours is $1,000, which is a pretty significant benefit. But like I just said, regarding the reopening of any of our departments or services, moving forward, the challenge is going to be making sure that when it's appropriate, having appropriate tasks for these folks to do with appropriate personal protective gear, because the last thing we want to do is bring seniors in working as volunteers under this program and not be able to ensure that they're doing it in a safe way and not putting themselves or others at risk. So this program's really focused and coordinated through the senior center. Many of those volunteers are actually people volunteering at the senior center, helping with the bistro meals program and running programs and things of that nature. It's a win-win all around, but the thing is, we're really going to have to look at making at the appropriate time the assessment of the safety so that people can participate in the program safely. So we're going to have to assess that, like many of the other operational issues that we have, in real time.
Thank you, John. The next question comes from Suzanne Sizlika of 8 Emerson Road. Suzanne, I hope I pronounced your last name correctly. The question is, when will boards and committees be able to meet again? And we touched upon that just a moment ago, but John, if you would just perhaps just quickly cap that one.
Yeah, so we're putting in the software and the policies, the structure and the training to move in this direction, because this is going to be it's going to be the situation we're looking at for the foreseeable future. So we've been acquiring equipment, software, and like I said, we have paid and purchased the webinar module of Zoom, and that is based on the group that's been assigned to look at this and investigate and make recommendations. That's the safest, most secure way for us to get back to boards and committees meeting. And specifically, the thing that we're most concerned with are the boards that routinely require public hearings, like the Planning Board, the Zoning Board of Appeals, Conservation, and the Board of Selectmen. It's a different level. It's one thing to hold a meeting. It's another to hold a public hearing and to do that effectively and still maintain security so we don't have any surprises. So that's probably a few weeks off. Again, that's something that we've been working on and will continue. As Jason said, we'll open this up in a phased priority approach. Again, we have 30 some odd boards and committees, and so we've been focused on the Board of Selectmen, Board of Health. We need to get back to appropriations, financial planning, our financial boards and committees, planning board, ZBA. Those will be the priority committees as we get going again.
Thank you, John. And if I could just maybe just as an example of clarification, for the people at home who are watching this and you're seeing all of these panels here through the Zoom presentation, all of the people that you see here have been carefully administered onto this conference in order to participate. Chief Parenti has been our coordinator for this. What he does is we determine that the participant list, he sends out emails for us to register. We submit the registration. In return, we get the meeting link, which I'm not sure if that's actually customized for each individual, but and then at the meeting time, we connect in and we're admitted again with his oversight. So it's being very carefully done. It's being very securely done. And when it's constructed like this, where you have a known set of participants, it's very easy, relatively speaking, to maintain the appropriate security for the duration of the conference. When you're talking about something like public comment, for instance, where at some point in the meeting, you'll now have people calling in or connecting in, and you don't have necessarily the same kind of protections in place or know who is going to call in advance and be able to admit them. That's the different problem that we face in that regard, and that's the problem we're trying to solve in order to proceed with public comment live during our meetings as we go forward. So just so that people understand some of the procedural stuff there that goes on in order to conduct these meetings remotely for the participants. The next question, this is from Laura Zeiton, 17 Franklin Circle. Can the Selectmen please address when they will resume public comments again? So as we just touched upon a moment ago and just now, we're working toward that from a technology and security standpoint. I don't know if that will be in place for our May 18th Board of Selectmen meeting. If not, then what I intend to do is once again have the public submit written comments through email to the board, and we will try to provide enough time during that meeting to work through those and address those. By the first meeting in June, I certainly expect and hope to have the ability in place for us to take live public comment during the meeting. So, next up is Millie Milton of 50 Fay Lane. There are several questions here, and I'll just begin reading through this. As we all know, the coronavirus has affected every single person in the entire country in one form or another. Private sector and small businesses have been hit hardest economically by government regulations and restriction imposed solely on it to lessen the impact of the illness. Numerous businesses have been shuttered for months. Working hours and service wages have been slashed. Unemployment has skyrocketed, and job security for those seeking to come back is questionable at best. Obviously, due to these losses, revenues for the town will be significantly less than those projected in the budget. I'm sure the town is very aware of many of these indicators. With that being the case, question 1, are the original salary increases and raises proposed in the budget being reconsidered? And if so, how? If not, why not? John, would you care to address that?
Sure. So in the original proposed fiscal 21 budget, all of our collective bargaining contracts are settled. We're moving into the last year, which would be fiscal 21. And they do include a 2% cost of living increase. Non-union folks get in accordance with the personnel bylaw, get the average, which is 2%. So that's what's included in the budget. So at this point in time, I'm not anticipating trying to get full table negotiations with 5 unions to discuss the fiscal 21 cost of living increase. Because what's going to wind up happening is, as I said, it's the last fiscal year. So in a matter of a few months, we're going to be back to full table negotiations for a successor agreement. So in all likelihood, if I were to try to contact them and want to discuss fiscal 21, that's a 4+ month process. And we're already going to be in full table negotiations for a successor contract. So that's where we're going to be focusing our time and energy. And I think everybody's realistic, or will be realistic, in terms of where we are. By then, you're talking about in the fall, we'll have a better sense of what our revenue profile looks like. We'll have a better sense of stimulus funds, state aid, and a better sense of what our local receipts are going to be doing. So that would be the intention.
Thank you, John. Ms. Milton continues, back in March, it was stated that the original goal for the closing of businesses, stay-at-home, shelter-in-place mandate was to flatten the curve so as not to overwhelm the hospitals and healthcare workers. The curve appears to be flattening in Massachusetts, and number of new cases are decreasing, so it appears the measures in place have been successful at accomplishing this. Given that there have been a lot of inconsistent and even contradictory information from various highly regarded organizations and experts about how to manage the spread, what measures are or are not recommended? I want to ask, question number 2, do towns in Massachusetts individually have the authority to override any of the state regulations or direct their own strategy or phases of reopening? Or does that have to be from the state directives? John?
If I can, through the chair, why don't you read the balance of our questions? Because they're all different variations of the same question, and then I'll answer them all.
The next questions, yes, will be in addition to that. How does Northborough intend to enforce some of these policies? What are the penalties for the town not enforcing the state policies? What authority, if any, does the town have to direct its own recovery and enforce its own policies? Are we able to direct our own as long as we stay within state guidelines?
Okay, so all these questions pertain to what's the local authority to issue Board of Health orders or things of that nature. And as I stated in the beginning, and I've had many conversations with Chairman French of the Board of Health, and our prior health agent has been keeping the Board of Health abreast of what's happening at the state level. But what you hear the governor say is, look, the state is providing this framework of response. And then towns do have their own authority to do specific things or to be more restrictive if local conditions warrant that. Now, there's nothing locally in Northborough or anything special that we felt is going on here that wasn't being addressed by the very appropriate and timely actions of the state, particularly the governor's office and DPH. So we've operated under the orders and the advisories of the state. And so, clearly there's nothing more for us to do if the governor shuts down the businesses. The question about, do we have the authority to reopen them? No, we do not. That remains with the governor. But it does get a little bit more nuanced when you talk about things like we discussed earlier on in the meeting about facial coverings. So at one point we were told we didn't have that authority. Then the Attorney General said, no, you in fact do. And so the governor hadn't acted on that right away. So we weren't sure that he was going to take action, in which case, through staff and working with the chairman of the Board of Health, we scheduled a meeting to take action because that was something that we as a locality felt was important and necessary. Ultimately, as you heard, the governor preempted that with his action on Friday, so our order became moot. So, but I will just say, as we proceeded, the state and the governor in particular, I think, has done an excellent job of putting out appropriate orders and advisories. We have complied, our local businesses and our residents have complied. And one of the things that has been stressed to us in all the press conferences, as well as the conference calls that I've had on a weekly basis with the Lieutenant Governor, is they have asked us to please, unless there's some real compelling issue locally for you to diverge and do something differently, please operate under our umbrella, because they have access to the best, most informed specialists who are giving them the best advice, and they're giving that advice to us. And what they'd like to see is the consistency across the municipalities to the extent possible. So a perfect example is if he hadn't taken action on his facial coverings, you might have a situation where you are literally walking in one town and you are required to wear a facial covering outside regardless of your social distancing or not, and you walk across the line to the next town over and you get a $300 fine because you're not following their local order. Businesses and residents want consistency. It's not like when you need groceries, you don't shop in Westborough, or in Westborough folks don't shop in Wegmans. You want that consistency. So until the Board of Health sees, or the staff sees, some instance where it makes sense for us to diverge from what the governor and DPH is ordering or recommending. First of all, if it's an order, it's an order. We are complying. And under those orders, our local boards of health are the enforcement agent. And as you heard from the police chief at the beginning of the meeting, the Board of Health has designated the police as their enforcement agent. So for purposes of the governor's facial covering, they can enforce that, social distancing, all of those things. So the long and short of it is we do have a lot of authority. The Board of Selectmen has certain authority, the Board of Health has certain authority, but they've asked us to please come along with them and be as consistent as we can, unless there's some compelling local reason. And to date, we haven't seen anything specific to the town of Northborough that is compelling that we should be breaking and doing something different. The only one area that I can think of in all the discussions that the task force and my discussions with the chairman of the Board of Health has been over facial coverings. And as I said, we have been told, or we were previously told, that we could not mandate that. Now, if we weren't given that advice, that's something I think we might have broken with the general state's approach and probably mandated sooner. So that's really the only thing I can think of. So otherwise, we will, again, try to comply. I think that when it comes to business, the world of business, what they want more than anything is consistency and predictability. And so you don't want to have various towns with radically different rules for things unless there's a compelling reason to do that. If we had an issue specific to Northborough with a communicable disease that we could institute an order of policy that would help our particular situation, then that would have warranted some discussion. But frankly, we haven't seen that, with the exception of the face mask, which we've discussed extensively. So basically, the Board of Health's approach and the staff's recommendation, this task force team that involves everybody, has been to follow and implement thus far the state's orders and advisories. So that's kind of where we are.
Thank you very much, John. The next question comes from Mitch Cohen of 12 Whitney Street. Mitch had several questions that he submitted, and anticipating that we might sort these by topic, he courteously submitted these each topic separately. So we appreciate your diligence there, Mitch, in helping us out. The question is, are there any debt projects the town may consider accelerating to take advantage of current low finance rates and likely hungry contractors who may bid very aggressively? And in combination with that, are there any existing debt issuances that might benefit from being refinanced?
So through the chair, I'm going to
Yes.
ask the finance director to speak to some of this, but I'll just preface it with this. During the recession in the early 2000s, that's when we got our senior center approved, and we actually saw about $1 million reduction in the cost over what the cost estimators had forecast. And there were some folks that felt we shouldn't go out in that environment. And again, that's a 20-year bond for a recession that lasted 3 or 4 years. And so sometimes this makes sense, but the simple issue here is that, and the finance director will speak to what the bond market is in the capital markets looking like right now, and our ability to actually access that. But the other thing too is, if contractors aren't allowed to work because we're on a shutdown, then it really doesn't matter that they're hungry to work. So a lot of things have to line up. But I would, through the chair, defer to Jason to speak to what our financial advisors are telling us about the bond market and the capital market, and also speak to the issue of when we would refinance debt, because that's something that we look at on a regular basis. So through the chair, I defer to Jason
Yep.
Little, Finance.
Finance Director Jason Little, please proceed.
Thank you, Chairman. Well, I'd step back for a second and say that when we issue municipal debt, we don't just call a bank or and ask for a loan. We have to access the tax exempt debt market, and we work through a financial advisor to do that. So leading up to us, renewing some of our bans that are coming up soon, our financial advisor has been sending me our weekly Moody's updates on commentary on municipal finances. And one of the things is that it's kind of a dismal picture for municipal debt right now. And one of the reasons behind that is that Congress hasn't really been quick to give stimulus directly to local and state governments, and the credit rating agencies are reacting to that. So like I was just saying, right now, the only unissued debt we have is in bands, bond anticipation notes, which is short-term debt. And typically those have a lower interest rate. So our plan right now is to stick with the short-term financing. In terms of refinancing public debt, we typically have pretty low interest rates as it is because it's tax exempt debt. So in order for us to refinance public debt, we would have to generate a certain amount of savings legally for us to be able to do that. And, we look at this regularly with the financial advisor. And like I said, since all our existing debt is at fairly low interest rates, it's very unlikely that we would meet that statutory threshold for being able to refinance anything right now. And
yeah, I would just add that some of this debt is below 2% already. Right. So you couldn't possibly meet that threshold. But the other thing, through the chair again, if I may, sure. During the last recession, we had the stimulus funds. You don't always know the form in which the federal stimulus packages may take. But the last time, there was a lot of money that came through various grant programs for what were deemed as shovel-ready projects. So working with the DPW director, we have a couple of shovel-ready or close to shovel-ready projects, including the water garage project and the rehabilitation project for the Assabet tank. Now, these are substantial projects. They've been designed, and they're sort of teed up and ready to go. So in the event that some of the stimulus funds come in the form of shovel-ready grants for shovel-ready projects, rather, we have a couple that we will certainly throw into the mix immediately, and then of course we'll look at any other potential options for us. But I think we're actually in a very good position if grants come that way to make immediate application for several projects that are in the hopper for us at this time.
Thank you, John. Jason, if I could ask one clarifying question. You mentioned bond anticipation notes, which are short-term financing. Is it correct? They're interest-only payments. Essentially, we're carrying the principal on those before.
Correct. But if we roll them over more than 2 years, reissue them for the same project for more than 2 years, we do have an obligation to make a principal pay down, which means that we would just take some money out of the debt issue and just borrow less the next issue. If that makes sense.
Is there there's a limited time over which you can renew bond anticipation notes before you're compelled to convert them to permanent financing?
Well, correct. I mean, we do have. It was previously 3 years, but the Municipal Modernization Act in 2016 extended that limit to 10 years. But like I said, we do have a requirement to make a principal pay down after 3 years.
Okay. Thank you for the clarification.
No problem.
Next question from Mitch Cohen, 12 Whitney Street. I was happy to see the strong partnership with the Chamber of Commerce at last week's Board of Selectmen meeting. Do you anticipate the town will host any career training events or job fairs, whether in coordination with the Chamber or otherwise, once buildings can reopen? John?
Sure. So great question. And as I said, our partner is the Chamber. So I did contact Karen Chapman, and she sent back a reply that they actually are considering organizing a job fair. She said if they do run one, they will let us know. We'll be contacted. And as always, they welcome the partnering with the towns to promote any events that they're doing along those lines. Right now, their events do generally draw significant crowds. And so in the current situation where they're unable to hold those types of events, it's being on hold at the moment. But essentially, they're always looking at doing stuff like that. And if and when they do, they will let us know, and we'll help promote those events.
All right. Thank you, John. Next questions, again, Mitch Cohen, 12 Whitney Street. The first one asking for a breakdown of cases by residential situation, again, assisted living versus residential. I think we've adequately addressed that. I think Mitch would agree. He understands what the response is for that one. He has another question along with that. Can you speak to any diagnosed cases contracted by workers in public places such as grocery stores, pharmacies, and other currently open retail establishments? General information or counts would be helpful. Please do not name any specific businesses unless absolutely necessary. So I guess the question is, do we have any indication of cases that that pertain to retail establishments or public places where people might tend to shop?
So again, if I may just briefly, so for all the reasons we've already discussed around HIPAA and the limits of the data that we're able to get or report, or DPH is able to get a report, there's really not much we can do in that realm. I'll just state though, we are unaware of any issues with any of the businesses in town in Northborough that anybody should be concerned about. That doesn't mean, I think that doesn't mean you should think there's no risk out there. Again, if you're going out, social distance, wear a mask, don't touch your face, wash your hands. You've heard this a million times. If you follow those procedures and other people are following those procedures, it is relatively safe to be out and about to get essential supplies that you need.
Thank you, John. Next question, Mitch Cohen, 12 Whitney Street. Huge thanks to all the public safety employees of the town. I would be interested in hearing about changes to workload due to the current situation, both good and bad, and how seriously is the general Northborough public treating the recommendations to socially distance and to wear face coverings? Why don't I go to John first, but perhaps the chiefs will want
The
to
two
comment
chiefs,
on
yeah.
this.
So
Yeah.
I just wanted to address the bottom one. The two chiefs can speak to their workload, which you've heard them comment on before. But in terms of the town of Northborough taking the recommendations to social distance and to wear face masks seriously, I'd say it's been a very good response, and we have been consistent in our messaging and trying to educate and get voluntary compliance. And so you heard the police chief speak to, the parks. I think early on there was some concerns expressed, but I think as things have progressed and people understand the seriousness of it, they're making sure that their kids are taking appropriate actions. And again, by and large, I think it's gone very well. The mandated facial covering, I think, is a huge step in the right direction. One that we would have implemented sooner if we were clear that we had the authority. But the moment we did know that we had the authority, we moved to do that, and the governor has preempted that. That I think is the single biggest. But so far, we're operating under the assumption that people want to do the right thing. They want to protect themselves. They want to protect their neighbors, their family members, and their fellow Northborough residents. So I think people are doing a pretty good job, all things considered.
Thank you, John. Chief Liver, would you care to comment on your workload? You're muted, Chief.
It's definitely down. We've seen a significant decrease in the calls for service. And those were where residents are calling us and asking for police services of some sort. It's directly correlated to the lockdown or the shutdown. Fewer people are driving. We've had very few accidents. Businesses are closed, so we've had few larcenies, with the exception of the bigger stores. The Northborough Crossing has in the past generated significant business for us with retail theft, organized shoplifting. They're closed, but BJ's and Wegmans have very good asset protection programs in place. So we're not dealing with that with the closure. House breaks aren't happening. Everybody's home. Our house breaks happen during the daytime when people are at work. We have 2-income families. So we've got the greatest security watch going right now. Unfortunately, that will come to an end. So there's fewer property crimes. And we have seen an uptick in domestic violence over the last couple of weeks. We've seen an increase in some suicide, overdoses, some opioid overdoses, and a definite increase in some mental health cases as far as folks having some crisis and doing some crisis counseling with our clinician that we have on board and some involuntary commitments. But that's just stress and people dealing with what's going on. Overall, I'm completely stunned at how quiet things have been. I think everybody here in town is doing a phenomenal job. Everybody here is positive and healthy. The guys come to work every day. Folks have been tremendously supportive of us. I can't tell you the number of times I've had to turn people away with goodies and things that they want to feed us, but it's things are going well. I think the folks in town are really doing a great job. I drove down the street this morning. I watched a woman walk 8 feet out into the opposite lane to go around someone on the sidewalk, both wearing masks. You don't have to do that if you're wearing a mask. But yeah, I think also it's age related. Older folks are taking it much more seriously. They're more of a jeopardized age group. Younger kids are going to live forever, so to them it's not such a big thing. So overall, very, very good response in town.
Right. Thank you very much, Chief. Chief Parenti, would you care to offer your viewpoint?
Yep. In March, we responded to 10 cases where COVID-19 was either suspected or confirmed. In April, we responded to 33 cases where COVID was either suspected or confirmed. And to date in March, we've responded to 4. So don't know what's going to happen with the rest of the month, but you could see we had quite a big jump in April. In conjunction with that, our overall call volume was down about 30%. And we understand it, and as Chief Liver said, a lot of that is due to people being home. So businesses not being open, cars not on the road. We understand that, but one of our big concerns, and I mentioned this in the last Selectmen's meeting, and I'm going to mention it again here today, is we're concerned that people are not calling us because they're afraid to either bother us or they're afraid to go to the hospital because they're going to either take away from services being provided to COVID patients or because they themselves are going to be exposed. We've actually had patients tell us who we think should go to the hospital, I'm not going to go because you don't come home from the hospital. That scares the heck out of us. Please, if you think you have any issues, we're concerned. And I was just speaking with our Dr. Tennyson the other day, our doctor, and he was telling us that they're concerned that people are going to be having heart attacks, going to be having TIAs, mini strokes, and not calling people. So a couple months down the road, these are all going to compound and make things much, much worse. We've suspended pretty much every single inspection we do. We have a few new ones we do. If it's a new construction and there's no one there, we'll go. But all of those are just temporarily suspended. So once everything's lifted, we're going to have that whole big catch-up game to play with residential house sales, with 26Fs, with all those other things. So the final thing I want to mention, and I want to give Chief Liver the kudos for this, is our birthday drive-by celebrations. This was Chief Liver's baby. He took it on. His guys are coordinating it. To date, we participated in 64 of those, which is an outrageous number. It's great. Sometimes we can't make it. Sometimes the police can't make it because there's calls going on. But I have received overwhelmingly positive remarks for it. And the guys really are out there. They'd like to drive by, they wave at the kids. And anyway, I just wanted to, again, thank Chief Lyra for spearheading that. And I think it's something small that we can do that makes a difference in a lot of people's lives.
Thank you, Chief Parenti. Chief Lyra, would you care to comment on that little program?
I didn't think it was going to take off the way it did. We actually had to drop the age limit down a little bit. So we've had people calling in for 80-year-old grandfather, you know, can you drive by his house? Unfortunately, we don't want to, you know, pull into Village Drive with sirens blaring.
All right.
We'd have more patience for the fire chief. Yeah, overwhelmingly, the reception is really great. We've had a couple of complaints because we scared somebody. I have gotten so many cards and letters and emails from parents saying, thank you for making this hard time very memorable for, you know, our 5-year-old, because you get to see a fire truck and a police car, and some of them are coordinating with their friends to drive by with us. So yeah, it's very, very positive.
Thank you. Thank you both and the departments. Please pass along our thanks to the officers and to the firefighter paramedics. I had a drive-by in my neighborhood for one of my neighbors, 5-year-old son, and it was terrific. It was really quite a highlight for that birthday celebration. So appreciate it. Thank you both.
I will say that it may have been my idea, but the only complaints we've gotten are the fire truck sirens are too loud.
Very good.
It's the sirens and the air horns. I'm sorry, we're bigger, we're louder. What can I say?
And we've come to the final email of the evening from Caitlin Borsini of 5 Mashpee Circle. 2 questions. One, how can we encourage more markets to switch to curbside pickup and have more pickup times available? My guess is that that's going to depend on the business operations themselves and what they think they need to do in their best interest. It's not something that the town can really influence or encourage. The recommendation I would have is to contact those businesses and ask them if they can do more to make your experience more convenient or more safe as you define it. John, would you have anything to add to that?
No, I'm just pleased that, you know, our local businesses have tried to accommodate folks. You know, you got a small town business like Tommy Lowe's. He will deliver groceries to seniors, you know, and so you know, I know my wife has had some difficulty getting pickups at Wegmans, but there are a number, like we say, we'd like folks to shop locally, but go to where you feel comfortable and get the services that you can and safely. But I think, as you indicated, it's a resource issue for a number of businesses, just being able to get the people to do it. But the best thing you could do if you want to encourage it is to contact that business and tell them that you would use that services if they would expand it, and that it's something that you're interested in, because that's what businesses want to know. They want you to tell them what it is that you're looking for, so they can provide that service. So I think that's really the best direct route, is to encourage them and ask for the services that you're looking for. But the ones that can do it and have the resources, I think really they're doing and continue to do the best they can under the circumstances.
Thank you, John. And the second question from Ms. Borsini, could we consider, this is apparently an idea she would have to allow recreational use in a safe way. Could we consider staggered days and times for recreational use of public space to reduce crowding in trails and skate parks and play areas when they reopen?
Yeah, I mean, it's an interesting concept. I just don't know from a practical standpoint how you would implement something like that. It's like the old gas station, you know, if you're an even numbered house or an odd numbered house, you know, you can use the trail on a different day. I think it really just comes down to, and I think it makes much safer if everybody's wearing a mask, then and you continue to abide by social distancing rules. It makes it much safer. But the idea is these recreational assets are, by definition here, these are the wide open spaces in the town, and people should be able to reasonably social distance. And if you can't, you should be wearing a mask. And I think that makes it relatively safe for most people. But, as far as the trails, from a practical standpoint, I wouldn't even know how to implement something like that. I'd rather spend our time, energy, and resources on educating the public to wear a mask and to maintain social distance. And as long as you do that, as I said, it's relatively safe to be out, particularly in the outdoors and enjoying some fresh air. Those folks that actually aren't stuck at work like some of us, it's nice to get out and see the sunshine and get that fresh air. It's important for your mental health. So
Thank you, John. And not a question, but just a final comment from Ms. Borsini. Touching on what we were just discussing a moment ago, thank you, Northborough Police Department and Fire Department, for bringing joy to kids all over town. We are lucky to have you. So thank you, Ms. Borsini, for submitting your comments. That brings us to the end of our list of comments for the evening. I guess at this point, John, we don't have any other business this evening for the board.
No other business this evening, but if I may, through the chair,
Sure.
just a parting comment on my part, and I say this at every public meeting that we have. If you or somebody you know needs help, assistance getting groceries or supplies, or is having maybe a difficult time mentally with the stress of the situation, please don't suffer in silence and don't suffer alone. We've got a dedicated staff here. We have resources. We're all here. We're open from 8 a.m. to 4 p.m., Monday through Friday. All the departments, particularly the senior center, family services, police, fire. If you need help, call us. That's why we're here, and we want to help, and we want to put you in touch with folks that can give you the resources that you need. So please call us. Don't, as I said, suffer in silence. And we've been very blessed so far that anybody that's called us and needed assistance or help, we have been able to make those connections and match folks up. And we've got a very giving and a very caring community that wants to help their neighbors. And so we're happy to help, but we can't help if we don't know that you need it. So please reach out.
Great. Thank you, John. School Superintendent Greg Martineau, would you like to offer any final comments for this evening?
No, I just, again, want to thank our educators. We have tremendous faculty and staff working on behalf of our students. We have amazing families who are supportive of education and our teachers. And we're a very fortunate community on many fronts, and education is one of those fronts. And lastly, just want to thank again the COVID-19 task force for the information, the partnership, and making sure that we're all in this together along this unprecedented journey. So thank you.
All right, thank you very much, Greg. Glenn French, Chair of the Board of Health, would you have any comments you'd like to offer? Unmute. Yep.
I unmuted him. He's all set.
Okay, yeah, go ahead, Glenn.
Thank you, Chief. The Board of Health is fully staffed and ready to go. We've been working with all the other boards and departments in the town, and Mr. Costello is well at hand. So with that in mind, we're ready to go forward.
Very good. Thank you, Glenn. And finally, I think I'd like to just walk through our members of the Board of Selectmen who have been listening patiently throughout the evening. I'll start with Julianne Hirsch. Any comments, Julianne?
Hi. Okay. So I would like to thank the COVID task force for all the great work they're doing. I think tonight was very informative, and I want to especially thank all of the residents who sent in those thoughtful comments and questions. I think it generated a really great discussion, and I actually have a list of about 6 or 7 questions that I'd like to follow up on, but maybe now's not the right time. It's getting late, and we can address those at our May 18th meeting, unless you want.
Well, why don't we decide, what we need to do to move forward at our meeting on May 18th. Yep.
Okay.
Thank you, Julianne. Leslie?
Yeah. I know that Liz had mentioned this at the last meeting too, as far as her outreach to the seniors in town. And I just want to say thank you again for that, because I think that's huge. Because if I see anything on social media, it's concern about the seniors and making sure that they're all set, that they have access to food and supplies and things like that. When you made these calls, were people concerned about access to food and supplies, or did people seem pretty much okay that they have their avenues for getting what they need?
Thank you for the question. The general sense is that everyone has formed their own connections through the community through either their friends, their family, their neighbors. Generally, people were just appreciative of the call and the check-in and thankful. There were one or two residents who said, hey, could you check in on so-and-so? I think he lives alone. I think he lives on this street. But generally, everyone had already set up their own network, so to speak, and they were just appreciative of the calls.
Okay, that's great. And also just another comment about senior veterans. I know there's a group in town, Borough's Cares for Troops, and I know that they've done an immense amount of work in getting supplies to senior veterans. Did you receive any feedback about that when you made the calls and it happened to reach senior veterans? Was there any concern on their part?
Not specifically veterans, no.
Okay, wonderful. Thank you very much for all your work on that. Thank you.
Thank you, Leslie. Tim Kalin?
Yeah, I just wanted to, thank everybody that was involved. And one group that I just wanted to thank are all the parents in town who have taken on the task of homeschooling. I have 2 kids, and homeschooling isn't an easy task. So I just wanted to thank all the parents for taking that on, in addition to everything else that you have to do as we go through this, and also thank the schools for all their help with the parents in homeschool.
Thank you,
Thank
Tim.
you.
Don Rand?
I'd just like to thank everybody that participated tonight, the very thorough answers that were given and thoughtful answers that were given to all the questions. And I'd like to personally thank the police and fire for drive-by birthday parties. I didn't know that was going on, not having a little one. So, but I think that was a great step to making kids a little happier. And I know just probably the adults that see the fire trucks and the police go by and wishing little kids a nice birthday. So just like to thank everybody. And that concludes my report.
Thank you, Don. And I'll just wind up by saying, certainly appreciate all the input we received from the submitters of the emails with their questions and comments. We certainly want to try to be responsive as we can. The current circumstances of conducting remote meetings poses some challenges. We want to be sure we're doing it right when we do it. I'd also like to I thank everyone here on the panel who participated tonight. These people, everyone you see in front of you, for the people viewing from home, all of these people in front of you are working enormous hours to try to keep the town operations running, and to keep the schools running, while also coping with the challenges and trying to plan both near term and long term. It's a lot of time, a lot of effort. It goes unseen. I want to make sure to acknowledge it, because it is important to understand how hard these people are working. So appreciate it from everybody. Town Clerk Andy Dowd, we wish you good luck in the upcoming couple of months as you make your way through the mail-in balloting process and also the election day process on June 30th. So appreciate all the work that you and Karen Wilbur will be doing in the town clerk's office to support that, and also whatever support we're having from our election volunteers. So much appreciated, everybody. If there's nothing else, I think we're concluded. I suppose this is a posted selectmen meeting. We need a motion to adjourn.
Motion to adjourn.
Motion made to adjourn. Do I have a second?
Second.
I'll second the motion to adjourn.
Moved and seconded. And as always with remote meetings, this is a voice vote. So Julianne?
Aye.
Leslie?
Aye.
Tim?
Aye.
Dawn?
Aye.
And I vote aye. So thank you all very much. We are concluded.